Is orbital anatomy scary or just boring? In this video, I will try to review orbital anatomy with silly jokes to increase memorization. I will talk about orbital anatomy, its bones, foramens, orbital surface anatomy, and then some clinical questions. The orbit is the cavity or socket in the skull that contains the eye and annexal structures. Its volume is approximately 30 milliliters. The orbital contents include 1. Eye, 2. Lacrimal gland sac duct, 3. Fascia, orbital and retrobulbar fascia, and muscles, extraocular muscles. 4. Fat, 5. Blood vessels, 6. Nerves, cranial nerves, 2, 3, 4, 5, 6, like an exercise, and short ciliary nerves and ciliary ganglion. 7. Eyelids, and 8. Ligaments, palpebral ligament, check ligament, suspensory ligament. 7 bones compose the orbit. 1. Frontal bone, 2. Zygomatic, 3. Maxillary bone or maxilla, 4. Lacrimal, 5. Ethmoid or ethmoidal bone, 6. Sphenoid, and do not forget the small triangular 7. Palatine. For the walls of the orbit, medial wall is the thinnest. It has the frontal process of maxilla, lacrimal bone, orbital plate of ethmoid, and body of sphenoid. The lateral wall has the zygomatic and greater ring of sphenoid. The floor has the orbital plate of maxilla, orbital surface of zygomatic, orbital process of palatine, and the roof has the orbital plate of frontal bone and lesser wing of sphenoid. And now to wake you a bit of surface anatomy.
So I need a volunteer. I forced this volunteer, so it's all right. For the palpable structures of the orbit. So first and the easiest one, the orbital rim. And superiorly, you can palpate the supraorbital notch. Sometimes it's a foramen and you would palpate about here. If it's the notch, you will palpate here in the superior rim. Third, the trochlea of the superior oblique muscle. So the trochlea, you feel it, you have to a little bit deep in, and it's supranasal, there it is. And just medially, or nasally if you want to, that's the lacrimal groove. You can also feel the infraorbital hole, there it is. And finally, the medial, you can swing it like that, medial palpebral ligament, and the lateral palpebral ligament. Thank you.
So back to business about the structures of the orbit. First you have either supraorbital notch or foramen, then zygomatico-fascial foramen, then the greater wing of sphenoid, then the lesser wing of sphenoid. There is also the inferior orbital fissure, the superior orbital fissure, and the optic canal. There are 5 foramina in the orbit. Number 1, anterior ethmoidal foramen, which carries the vein, artery, and nerve with the same name. You can memorize as VAN. So it carries the anterior ethmoidal vein, anterior ethmoidal artery, and anterior ethmoidal foramen. Number 2, posterior ethmoidal foramen, which carries the VAN of the same name. Number 3, optic canal or optic foramen, which carries the optic nerve and ophthalmic artery. Number 4, superior orbital fissure. Number 5, inferior orbital fissure, which carries the infraorbital van, 5.2, and zygomatic branches of the 5, trigeminal cranial nerve. For the superior orbital fissure, it carries cranial nerves 3, 4, 5.1, which is the lacrimal, frontal, and nasociliary branches of the trigeminal nerve, and 6. And it carries the superior branch of the ophthalmic vein. The This figure illustrates the optic canal and the superior orbital fissure. It also illustrates the ring of Zinn, which contains the insertions of the inferior, lateral, superior, and medial rectus muscles, which I'm writing here in green. The superior oblique is outside the ring of Zinn. As for the superior part of the orbital superior fissure, there is the lacrimal nerve, the frontal nerve, and the trochlear nerve, which is the number 4 cranial nerve, and the superior ophthalmic vein. There is also the superior division of the oculomotor, third cranial pair, and the nasociliary nerve, the sixth pair, which is the abducens, and the inferior division of the third pair, and finally the inferior ophthalmic vein. Before ending, what's the weakest wall in the orbit? It's the medial one. How many bones are in the orbit? 7. What's the most frequent cause of cellulitis and why anatomically? Orbital cellulitis, an infection of tissues behind the orbital septum, different from periorbital cellulitis before the septum, less serious, is caused by a sinus infection, frequently sinusitis, in which bacteria enter the orbital cavity through the ethmoidal bone, which is thin. Thank you. I hope you enjoyed and I hope you did not fall asleep. Bye bye.